And I think because you sent me some beautiful paintings that you did as well, and the way you describe it when we were talking was also like you feel these kind of like wave-like movements, or like wave-like, and it was kind of almost embryonic. Could you talk about that?
Well, those pictures were because I had these images. For this, it may be interesting for the cranial people. I had the images of the cranial fluid being separate to the brain. It's a shame I didn't know this. I would have got the pictures out. But and so you've got this cranial fluid around the brain, you've got the cranial fluid in the ventricles, and then around the spinal cord. And when I was doing holographic breathing, if I imagined it in that way, it was like it was killing me. If I imagined it was like how the anatomy books describe it, it was killing me. And the experience I had with holographic breathing was that the cranial fluid was through the whole brain and around the brain and in the ventricles and between every cell, and also travels out through the nerves. That is why I call it the cranial sea. It's a combination of the interstitial fluid, if that's the right name, and the cranial fluid. It's all. And the cranial fluid, it's only about 150 millimeters in the books, but if you include all the fluid in the brain and everything, you know, you're getting like a lot of fluid. The brain is 90% water. And I started researching it. They're the same. The cranial fluid, 99% water, 1% salt, oxygen and glucose. The interstitial fluid inside the brain is 99% water, 1% salt, glucose and oxygen. They are the same fluid and they act like water, and they just flow down. Ridiculous that they should flow up and go out through the venous sinus. The venous sinus is for the blood, it's for the venous blood, and it's the right size for the venous blood, for this huge amount of cranial sea that's going to leave. It's going to have to flow out through the nerves, and it's going to have to flow out through the dura. And that's how I describe it, and that's my experience of it. This is for another really interview where we can go into that in depth, where I can show the diagrams and how it relates. But I experienced it in a new way, and because I started teaching it and the anatomy was new, I just painted all of these pictures